So much of AI discourse is centered on rich countries, their workers, their firms, their labor markets. But what happens when you shift the lens to less developed countries with different needs and access to AI? My guest today is Deena Mousa, Program Officer at Coefficient Giving, and one of the sharpest writers on how AI intersects with global development. Here's our talk. Welcome to the Economics of Work. I'm excited to welcome Deena Mousa. Deena's a program officer. Is that your title? Deena's a
Yeah, that's
program
right.
officer at Coefficient Giving, formerly Open Philanthropy, and is one of the deepest thinkers and writers out there about how AI affects development. Deena, welcome to the show.
Thanks so much for having me, Ben.
Yeah, of course. So I wanna start with like a a question that I think is like got a lot of questions underneath it, which is why are there so many radiologists in the world right now?
It's a great question, Ben. And I think one that a lot of people are wondering, especially given it seems like one of those professions that is the most automatable, if any, of the white collar work. So it is completely digital. There's not a lot of pen and paper involved in radiology anymore. It's very based on pattern recognition, which is something we think of as AI being very good at. And it's mostly done, we think, like in isolation, basically. If you read a scan, you don't really have to be collaborating with a lot of different people. So it seems like almost like the perfect use case for AI automation. But I think it turns out for radiology, as for, I think, we'll find soon, most professions, not so simple. I think there's a quite a big gap between benchmark performance and actual clinical performance in ways that are underrated. So you can have a benchmark, and we have, that have said models are significantly better at humans at detecting a particular finding on a particular scan. But that doesn't necessarily translate to replacing their work entirely. So one of those reasons is they're often trained on a particular sample data set. So they're trained on a set of like one, or maybe if you're lucky, a couple of hospitals. And that means that they generalize poorly when they're brought to new locations. There is a particularly funny example where they found that a model was recognizing when chest scans were done with a portable scanner versus done in the radiology suite because the images look slightly different to one another. And as you can imagine, often sicker patients are given the portable scanner. And so it was generalizing from that if you're using a portable scanner, you're much more likely to have pneumonia. And I think that sort of demonstrates a little bit of this black box of AI. We don't really know how it's coming to the decisions it is. And so this makes it much harder to generalize in new contexts or when you have new demographics in a particular hospital.
Yeah, it kind of reminds me of the early days of Kaggle competitions when the winner would be someone who like hacked the user ID of something to find out like that the ID number was that they were really in like, one class versus another class. Um, so yeah, I mean, I wonder if the fact that it doesn't generalize well is actually really just a problem with, classified machine learning as a tool. So when Jeff Hinton was predicting that radiologists would go away, that was under the presumption that image classification was as good as radiologists. If image classification actually just wasn't as good or didn't generalize as well, then maybe it's, you know, just not a good example because surely there are some things where performance will generalize and will actually work well out of sample. So if it just so happens that the technology wasn't there, then like, all right, so we got that one wrong, but it's a technology failure, not an implementation failure. Do you think that's like a valid critique of this as like a useful example?
I think a couple things here. One is that it's partially not necessarily being incorrect about the nature of the technology itself, but about how you need to train it. So, how much data do you actually need for a model to be able to be useful out of sample? And also, I would say I think radiology is a good example because I think we underrate, and I think particularly, in the Bay Area, it's very easy to underrate the nuances and like complexity of different tests and different careers in particular. So, what does it look like to be a radiologist? I think if you ask most people on the street, they would say, you sit in a room in a basement and you grade a bunch of images all day and then you go home. And it turns out the job is much more complicated than that. And I think this basically applies to all professions. Like there's a lot of nuances, there's a variety of tasks that people are doing.
So do you think you know, it's almost not so relevant whether the technology would have gotten there. Like, let's say the technology for classifying images were just perfect, but the job were still very messy. I mean, that kind of sounds a little bit closer to the paradigm we're facing with AI, where it actually is really good at some things, and it's not going to fail in the out of sample cases, and will probably get better. But the jobs are still as messy as they've ever been. Is that like the major explainer in your mind?
I think that's definitely a component. So in a lot of cases, radiologists are working within a system. So they're working with, for example, like the main doctor that's seeing the patient. They're working with other folks in the hospital system to make decisions about, what the right type of image is or how to contextualize the particular patient. And I think once you put people in a context and a web of other people, it gets a lot harder to automate just one node of those at a time.
Yeah. So one hypothesis that I would think is that, as image classification gets better, the radiologist's job would probably get more integrated and more messy. Do you think that's the path that we're on?
Yeah, I think that's a pretty reasonable hypothesis. I think that one sort of dynamic here that's driving some of this is that as we get more tools that are good at making imaging faster and easier, demand for imaging grows and demand for really complicated types of imaging grows. So there are entire use cases that we did not use imaging for pre-digitization because it was just too slow to get a scan, for example, in a trauma case for it to make sense or be worth it for someone to look at that. But now that we've made reading and taking scans faster, that is a whole set of use cases that are unlocked that are much more complex and high stakes. And so I think we could definitely see that continue. We could see, I think the demand that folks have, I've realized for, learning things about their body and like diagnosing themselves, even healthy people, is very, very high. So I think there's quite a bit of demand left to saturate.
Yeah. Okay. Interesting. So if we think about this like untapped demand framing, and maybe, radiology, something like Jevons paradox, when costs fall, actually consumption goes up, blah blah blah. That's one channel where it's like direct, image scans, the demand for direct image scans goes up. But then there's another channel, or maybe it's the same, but there's potentially another way of thinking about it, that maybe image scans can be part of other processes, and maybe it gets embedded into some other form of medicine or some other form of God knows what, maybe not even medicine. And that's really when we enter the domain of kind of new jobs, new implementations, new systems, and maybe that's really what unlocks the big swath of employment possibilities. Do you think that sounds plausible?
Yeah, potentially. I mean, when I look at, like concierge medicine and preventative health startups that have cropped up in the last 5 to 10 years, like Function Health and Pronovo, that do these, preventative annual full body MRIs. I can definitely imagine people in like coming up with new ways to use this sort of data that goes far beyond diagnosing a particular issue and more towards this sort of like 360 conceptualization of health. So in the same way that you might have a wearable that you get data from every single day, maybe you go in every month for a scan if it gets sufficiently, cheap and easy to read those and people have sufficient demand.
Yeah. So, as I would think through these, I think it's easy enough to think about them conceptually, oh, this is how employment gets created. But for you, you have to think through, just in your day job, you have to think through like what might happen, with a specific through a specific program, like what are the downstream effects? Like to me that sounds very hard. I mean, how do you think about the downstream effects of some treatment or some, technological implementation?
Yeah, it's definitely hard. I would say there's a lot of inherent uncertainty, and I think acceptance is the first step here. There's just no getting around the fact that we don't necessarily know what will happen, but I think we can model different worlds that seem potentially likely, and then go through the steps of, okay, if this is the world we live in, what would the second order effects be? What would the third order effects be? And then what would happen next? And you can sort of do that for a range of worlds that fall all over the spectrum. And that can help kind of like guide the decision making a little bit in terms of, okay, which of these worlds seem most likely, or in which of these worlds would it be most important for us to act, which I think is also another way of deciding, which ones to index on more.
So this different world framework, do you think that the the relationship between technology and employment, this world that we could potentially model, um, is very different in the developed world versus like low and middle income countries? Like, is this mechanism fundamentally different or like kind of similar? How do you view how poor countries are different from rich countries?
Yeah, I think there are very meaningful differences. I mean, when we're talking about radiology in the US, and the labor market disruptions, I think often the first questions are, will radiologists still have a job? Should we still go to medical school and opt into that specialty? But in a lot of low income countries, they have a single digit number of radiologists in the entire country. So they're not asking that question of will radiologists in this country still have a job? They're asking the question of, will more people be able to see a radiologist? And I think that focus on, like increasing the throughput and the of like limited human capital is much more the frame of the question in low and middle income countries than it is in places like the US.
Yeah, so much of these discussions of technological unemployment seem to be coming from a place of just sort of saturating our demand. Even in like the 100 years ago Keynes essay, economic possibilities for our grandchildren, he describes this like life of leisure that we're all kind of going to live when we have productivity growth that exceeds some amount. And it just seems so ridiculous when applied to low income countries. I mean, we're nowhere close to that, capacity. I mean, I happen to think we're not really so close to that in the developed world also. Um, but it does seem a little silly of a framing. I mean, when you hear that framing that we're just gonna like have all the stuff we want, do you sometimes think like, okay, there's a whole other world out there. Like we're not all living in Silicon Valley. Like do you get kind of impatient with that?
Yeah, I mean, I think it's pretty natural. I think obviously a lot of the discussions are happening in high income countries. And of course, people are thinking first and foremost about jobs like theirs. They're thinking about, white collar workers in rich countries. And it's sort of almost an automatic like blind spot, I think. And I think it makes sense from the perspective of, people want to know what will happen in their own lives. And that's the context they're familiar with. So I certainly don't blame it. But I do think it's a pretty important conversation to have because I am a lot less worried about, what will happen to folks in the US versus in low income countries. I think the US obviously will capture quite a bit of the, productivity surplus from AI. The question is more, how do we make sure that's distributed properly? How do we make sure, we're creating the right future? But in a lot of other countries, that is not necessarily the case, and they're trying to figure out how do they even slot into this, new brave new world.
Interesting. Okay, so I would think that in the US you can maybe be concerned with employment effects. Like, okay, is this like going to displace, you know, the need for labor? Or are you all just going to like live on UBI or something? But that's not really, doesn't seem like that's such a relevant question in low income countries. So what do you think the risks are? Like what are the buckets of risks that make you most nervous?
Yeah, I mean, I think one particularly important threat model is when we think about, a country's development prospects, we often think of this development ladder where they sort of move up the rung. So they start with subsistence agriculture, they move on to become more industrialized, and then they sort of slot into these high income country like labor markets through service exports. So through things like IT support or BPOs or call centers that then enable them to get a slice of these, like very high income country wages that then help the rest of the country sort of continue to develop. And that's long been considered like a major path out of poverty for a lot of countries. But I think one of the things that made this really attractive in the age of the internet was that you can distribute labor. You can have a job that you need in the US and you can have the employee be in India, for example. But that very same trait is what makes it most automatable, unfortunately, is that you can do the job anywhere. There's no physicality to it, there's no need to be located in a particular place. And so I think there's a lot of reason to be concerned that, call centers, IT support, and so on, that are distributed in low and middle income countries are probably going to be among the first to be hard hit by automation. And so the question, as one of these countries that has these industries, is what do you do next? How do you continue to grow? What do you do with that labor market?
Yeah, I mean, I never really know what to make of this kind of development ladder concept because I mean, I don't really think I get why the sequence, from subsistence agriculture all the way to like services-led export growth is is a meaningful sequence. Like, I guess you can sort of tell a story about how, you know, one thing has to come before the other, but I don't know that I find it so convincing about why sequences couldn't happen in other ways, especially if they're kind of aided by certain technologies to kind of leapfrog certain steps. I mean, one very simple model is just like supply creates its own demand. And, if you've got productive capacity, then that will just, you know, create output, which, goes around and around until you have demand for consumption of that output, and that could be within the country, outside the country. I mean, that's like obviously a very simplified model, or a very simple model, but why is that insufficient? Like, why do we, yeah, what is the best way to think about the utility for thinking about like a development sequence?
Yeah. I mean, I certainly think the sequence could look different. Like there are different models and different worlds we could be in where the path is not quite the same. So certainly I think ideally there are alternatives to service exports and hopefully in particular there are in this world. But I don't think it's so inevitable as your framing suggests, if that makes sense. I don't think it's the case that if you have enough productive people in a country for long enough, they sort of find the right product to produce and sort of naturally move in that way. I mean, it's a very like sort of like attractive model from like a free markets perspective of the market sort of always clears and people figure out the right thing to do. But
Yeah, it's a little Hayekian in a way.
yeah, no, I think that I mean, but I unfortunately I think that doesn't really bear out. So I think one example that can help make this clear is Malawi, which I think is like a good one to take because there are no like exogenous contradictory factors. So there's no brutal dictatorship, there's no civil war, there's no major disaster that we can be talking about instead. And yet Malawi is majority subsistence agriculture and has been for quite a while. And that's true, in spite of huge technological gains in agriculture and agricultural productivity, that hasn't necessarily resulted in the level of yield growth that we would expect. And even though it has resulted in some yield growth, hasn't resulted in people moving on from subsistence agriculture to maybe more productive means of like combining farms, for example, and like some subset of people, urbanizing and creating new jobs and industrializing in the sort of pattern we might expect. And I think that it's just an example of like unfortunately it doesn't always happen automatically or naturally.
Right, for sure a lot of things have to go right. Like in order for Malawi to reach kind of breakout growth level, there would be so many things that would have to, you know, fall into place. And it seems like the breakout growth pattern is more of the exception than the rule. I mean, I know Malawi's like kind of an outlier in terms of how poor of a country it is, but the there haven't been that many examples of kind of breakout growth. And when that happens, it seems like, you know, there's things kind of come together to to, make sure that productive capacity yields actual actual output, consumable goods and services. So what do you think, if you're kind of, you know, running the government, or is somehow in charge in whatever way that means. I mean, what do you think what do you think you would be trying to put in place? Like if there is going to be a boom in Malawi, what do you think has to precede that?
Yeah, it's a great question. Is this in the context of AI in particular or more agnostically?
Uh, Whichever one you want. I guess either way. I mean, it's hard to think for me these days. It's hard to think agnostically without thinking about AI,
Yeah.
because it just seems to be just a very powerful thing that we don't really know what it is or how it'll work. But let's say, yeah, let's say, kind of in between those two things.
Okay, makes sense. I think the answer is quite different for low income countries as opposed to middle income countries, which I think is underrated because we often bundle them into this acronym of LMICs and it just kind of gets reduced to one thing. But a place like Malawi is very in a very different position from a place like India or the Philippines, for example, and I think just needs to do different things. In the case of, let's say, like a country like Malawi, I think, thinking about their current sort of like economic mix. Uh, so, like agriculture and the types of crops that they produce, like maize and tobacco, I think are unlikely to be radically affected in demand by AI. So, unlike the service exports, I don't think they're getting as big of an immediate negative shock from AI.
The OpenAI commercials would would lead you to think otherwise. Wasn't there a commercial of like someone taking over a family farm and just using AI for their family farm? Did you see that?
I didn't see that particular commercial,
Oh,
but
it's
definitely
funny.
that's a yeah,
Yeah, it's funny because it's not what I would think of as the best use for AI. But
right.
that seems to be a very deliberate choice, to present, AI is useful for like farming strategy. But yeah, I didn't really buy it either. But anyway, go on. Yeah.
Yeah, I mean, there's a lot of use cases of AI for, like agronomy advice and maybe like better weather forecasting and translating those forecasts to specific guidance. But I don't think that's going to be like the game changer in these low income contexts. Like, I don't think it's going to be as big of a step change, maybe. Um, I think in this case, uh, part of I think the sticky spot that Malawi is in is due to having maybe too much civility. They have like a very functioning democratic government, and the majority of people in the country are subsistence farmers who grow maize or tobacco. And in the case of maize, there are just quite a number of like government supported subsidies for things like fertilizer to support those farmers that unfortunately drain quite a bit of the government's budget and also keep people locked into growing this particular crop. When, counterfactually, for example, you could move on to more climate resistant crops like sorghum, or to more sort of like lucrative export crops. Like you could, in theory, be growing coffee in Malawi, most likely. And so I think that keeps them in a bad equilibrium. I think there's something similar going on with tobacco, but it is mostly tobacco companies rather than the government. So they provide a lot of financial instruments that allow people to, for example, borrow ahead to buy the seeds that they need to grow tobacco at the beginning of the season and pay it off at low interest rates later. And that infrastructure doesn't necessarily exist for other crops. So I think it's unfortunately a question of like political coalition and political settlement of, what is the holding pattern that you're in the case of Malawi. And I think like the probably the most like short term successful bet would most likely be trying to shift to a crop mix that is attractive as an export to high income countries. If you believe that, AI is going to result in significant amounts of prosperity and abundance in rich countries, I think it's still the case that we probably won't be growing chocolate in the US, at least for a while. And so I think you capture some of that sort of like wealth by being able to export to some of those countries. So I think if you're an agrarian low income country, that's probably it seems like the most compelling strategy to me.
Okay. Okay. Well, what about middle income countries?
Yeah, so I think that that is where it gets a little bit more complicated. So I think there are some sort of like no-brainer moves. So I think, for example, you want to make sure you're digitizing your data. A lot of data in these countries is done on pen and paper, but AI models cannot be useful without data, and that's, I think, one of the biggest bottlenecks for middle income countries in having useful models. It's not the model themselves, it's being able to feed it context rich data that is specific to their country. And so like
Well,
getting that in order, I
let
think
me
is
ask. I
like
mean,
a,
I go back and forth on how much that matters. So for something like radiology, I get it. There's you're taking images of something. You need medical data that's like tailored to that population. But for other things, just being a practitioner that uses AI models, they could be useful to a population even if it wasn't trained on anything from that population. Like imagine that, all the AI models were trained using data from people with brown eyes. It would still be useful to people with blue eyes, just because, like, they're not that different from people with different colored eyes. And, obviously, like, low middle income countries are different in some ways, but a lot of what, someone might learn from AI models are just general business, finding recipes, whatever it is, something that doesn't really vary that much on context. I mean, do you think this argument can be like overstated a little bit? Like, I would think that would be a very important model. That would be a very important way of thinking about the disparate effects, when AI was really about supervised machine learning. Now I wonder how much that matters. I don't know. What do you make of that?
I think the models can definitely still be useful to individual people using them, regardless of the data mix. But I think the thing is, as a middle income country government, your ambition should be much higher. So I don't think you want, everyone in your government to have a Claude Code subscription, though of course you do, but I don't think that's, sufficiently ambitious or how you're going to actually like capture much growth. I think you want to do something where you're integrating AI into your medical system, for example, and turbocharging the ability of doctors to make diagnoses at 3x the rate that they could previously see way more patients in a day and therefore like significantly increase the capacity of all of your city hospitals. I think you want to be integrating AI directly into, for example, your like public service provision and like the tax base and like using it to analyze, okay, exactly how should we set our taxes for optimal tax policy based on the literature and this pattern that you see in the mix of people who make different incomes. What should we be doing for optimal tax policy? I think those are the kinds of questions that, where you can actually capture quite a bit of growth from AI. And I think that certainly does require a ton of data and a ton of integration with your existing systems.
Yeah, and that's specifically kind of public sector led growth. But like, what if you had some policy in India where you wanted to make the offshore engineering teams in Bangalore more productive? I mean, that would presumably be just about deploying and incentivizing just general AI adoption, right? Like, do you think there's a major distinction between ways to kind of improve private sector performance versus improve kind of public sector adjacent things like hospitals?
Yeah, I mean, I think basically, yeah, there's a distinction between the use case of AI for uplifting an individual worker's productivity versus using AI to improve a system, basically. And I think in the first case, where the AI is always in a centaur model, it's always directly tied to a person doing a task, then sure, yeah. I mean, that person individually can feed it all the data that it needs to do their particular tasks, which they're very high context on. I just think that's like maybe a more limited set of use cases.
Yeah, and are you seeing most appetite in these kind of more systems change implementations or more systems change programs? Is that like what people are thinking about in these communities and these conversations?
I think that's a lot of the high upside projects, essentially. I mean, certainly there are a lot of like individual use cases where, for example, folks are thinking about how to roll out, you know, uh, an app where you can sort of triage yourself and figure out whether you need to go to the nearest city to a hospital or whether you're, fine to wait another few days. Or, yeah, an app for a farmer to get advice on when to plant their crops given when the monsoon is going to hit. Those things, of course, require a lot of, I think, specific data as well because they're pretty contextual. Um, but I think that's, sort of one class of thing. And then there's another class of thing, which I think is like more government led, which, if you're sort of, yeah, one of these country governments, I think is one of the things that you should be thinking about because you are the only, entity positioned to actually do a hospital countrywide rollout of AI, for example.
So when you think about programs that you're looking at incubating, do you find yourself looking for high upside big bets or kind of more limited downside safe bets or a mix?
Yeah, I mean, I think often in like expected value terms. So I mean the high upside big bets are also more likely to fail, and I think that's sort of inherent to them. And so often it ends up being a little bit of a mix. I think the high upside big bets end up being more attractive on expected value terms, though, even considering the higher propensity to fail. But I do think there is room for a mix of like there are quite a few I think like common sense interventions that and I don't think that they should necessarily be ignored. And often they're like sort of necessary bottlenecks to being able to make bigger bets in the future.
Yeah, yeah, interesting. I mean, as you're thinking through this kind of like maximizing expected value framework, um, do you do you think what you guys do at Coefficient Giving is do you think it changes as the effective altruism movement changes? Like do you think of yourselves as kind of in that world and sort of changing as that world changes or kind of a little bit distinct?
Yeah, I mean, I'd like to think that it's more anchored on independent thought rather than necessarily like following the mores of like a broader community, if that makes sense. I think there's obviously a lot of like history and ties between Coefficient and EA, but um, yeah, I think it is definitely the case that we sort of like think independently. Certainly, not everyone in the organization would even identify as EA or is super familiar with EA. And so I do think it leads to like a mix of perspectives and yeah, I would say it's I don't think it's necessarily the case that, when something becomes popular within the EA community, it necessarily, is exciting for us.
Interesting. I also think of you guys as distinct from EA, sort of independent to EA, but it is surprising to hear that you think it's that distinct. I mean, I would have thought that everyone at Coefficient Giving would have some association with EA. So you think it's like really, really not distinct, huh? Well, yeah. Why is that? I mean, what is the history there? Do you think that yeah? How would you characterize like the distinction between your mission, what you do, and the EA mission?
Yeah, I mean, I think the like core question here, which gets messy, is what is EA? And I think the narrow definition always seems to me most useful, which is like it's an orientation toward doing the most good with the resources you have possible, from the perspective of like sort of widening your moral circle, viewing people as equally valuable, whether they're near or far to you, and when I say it like that, that sounds very common sense, but I would say that's like actually relatively unique as a framework for a philanthropy, for example, to have. Like most philanthropies have cause areas that they're most interested in from the beginning, and that's on the basis of, the founder, the donor has a lot of like sympathy for X particular problem or X particular group of people, which is also like a totally valid model. But all this to say, it is meaningful to say that, we are quote unquote EA from that perspective of, we're cause agnostic, we're impact maximizing, we view people as sort of like of equal value, regardless of the country that they live in. And I think in that sense, yeah, coefficient is very EA. But I think EA has sort of slipped into, whatever it is that a particular group of people that you associate with being EA are thinking about in the moment. And I think you can take that set of principles and you can go in many different directions, which, yeah, I mean, you can see from the community, lots of people have taken it and they think about malaria nets. Some subset of people think about wild animal welfare or farmed animal welfare or catastrophic risk or AI safety. And these are all sort of like reasonable extrapolations of the same framework and way of thinking about things. But I think being EA maybe necessitates the framework, but doesn't necessitate agreeing with all of the conclusions or every conclusion that, someone can draw from it, if that makes sense.
Yeah, yeah, I think that sounds right. I mean, I think when I first found out about effective altruism as a concept, I thought, oh wow, this is like so obviously cool, and that it's very economicsy. Of course, we should be trying to do the most amount of good with limited resources. Like, why would anyone think any other way? It just seems so obvious. Um, and it kind of, to me, as an economist, it felt like an offshoot of economics in a way. Um, but but yeah, it's kind of taken on a life of its own, and I guess to me has felt a little weirder in in the past few years. Obviously, with like Sam Bankman-Fried doing his weird stuff, but also just with AI safety and long-termism taken to the extreme. It just felt like, all right, we're sort of losing the thread a little bit, or losing the plot, I guess. Um, yeah.
I think there's a high correlation between, viewing that sort of framework that I talked about of like maximizing good and, valuing people far from you equally to people close to you. There's a high correlation between, buying into that and a few other traits, I think, which like things like high decoupling, like an ability to, take something that sounds crazy at face value and think about, okay, could this potentially be true? I think it also correlates with like a willingness to take the extreme implication of something you believe. So I think like a lot of people have like principles that they believe in, but if you point out the sort of like most extreme implications of that, they won't necessarily buy into those. But I think there's more of a willingness to say, hey, hang on, like I do believe this in general, and this is an implication of that. I should take that seriously. So I do think it's more like it correlates with certain ways of thinking that end up leading to like potentially just like uh, ideas that are much less likely to be accepted by the median voter, if that makes sense.
Yeah. Yeah, totally. I mean, your regular person walking down the street is not gonna have any opinion about colonizing Mars. Like that's just
Yeah,
not,
it's
but
true.
yeah, you could like, get someone to think that that's the most important thing in the world. But I like your framing that it is like, you know, correlated with the predisposition to believe, in to sort of think that way or sort of take thoughts to their extreme. That sounds right to me. Um, so I wanna gauge your reaction to criticisms about philanthropy in general. I mean, there's like a class of development thinkers that you know, sort of point out that maybe we are, you know, doing things wrong, or maybe having negative effect, sort of there are negative consequences to, um, coming in as experts on a certain topic and in some way inadvertently kind of weakening the relationship between the government and the governed. And there's all sorts of theories on why we may not be doing the good that we'd like to do through a lot of different forms of philanthropy. And obviously, you're a person and work in an organization that believes strongly in like evidence and results. So I want to gauge your thoughts on like what do you think of that line of reasoning, and where do you think you deviate from that?
Yeah, I mean, I certainly think there are risks to particular types of interventions or aid. Like, it is certainly not the case that any aid, any philanthropy, any grant is, always going to be a good grant. You can certainly, there you always run the risk of doing harm, um, if you are not careful about the mode in which you're thinking. And so, I certainly don't want to say that, every form of aid or philanthropy that has ever been done has always led to positive outcomes. I think that, development as a field has made a lot of progress in learning about what structurally, where can this go wrong, and in what ways can you try to like basically minimize the potential for harm. So I mean, some examples of things that I think are more kind of like unambiguously good or like unlikely to have much risk of harm. We do quite a bit of like science and R&D funding to develop new treatments or new vaccines. I think like things like that like boost the progress towards a like clearly good technology that doesn't have obvious downsides. I think that's sort of a case in which you can get around some of the concerns around, or are you building dependence of a particular country's government, for example. So I do think it is a risk, but I don't think it's inherent to all modes of philanthropy. And I think there are many approaches that you can take that sort of get around this risk of, are you, messing with a system much more complex than is possible for like one person to fully understand, if that makes sense.
Yeah, yeah, interesting. I once heard Angus Deaton say, I think he was asked this question, like, what should we do to help the poor in developing countries? And he said, well, first thing, I would stop selling them guns. And that was kind of his first response. And it also, so that's one possible answer. Another answer that I heard not too long ago was this concept that we in the developed world are very often kind of um, inadvertently boycotting poor countries by, you know, movements toward fair trade, ideas that we don't want to um, buy things from workers that we think are in vulnerable positions, and that sometimes gets conflated with exploitation. And we end up sometimes um, just not not being good customers to poor countries. And so, with those kind of two thoughts, I wonder how much of helping developing countries is about what, actions that are taken outside of those countries.
Yeah, it's a great question. I mean, I do think it's right that sometimes some of these like social progress movements can have inadvertent effects that people don't necessarily expect. So, I think the example you gave is a good one where, sometimes people working in poor conditions, the way that they get out of those conditions is by having a stable base of consumers who are buying their goods. And that works much better than, a boycott, because it's just simply not the case that the factory is going to be built with much better, cleaner working conditions. It's just going to shut down entirely. And I do think there's a little bit of it's uncomfortable. I think this is a little bit where the high decoupling, kind of has to come in, where you think about like, yeah, like you two things can be true at once. Like the conditions can be objectively suboptimal, but it can also be the case that a straightforward boycott is just going to make them worse. I think that's hard to reckon with, because that feels like the easy, straightforward, comfortable, moral solution where you sort of abdicate yourself and absolve yourself by not participating. But often that can just result in like even more negative consequences than if you had done nothing at all. And so I do think that mode of thinking of yes, two things can be true at once in general is quite important to thinking about how to engage with development questions. like things are not necessarily going to move from where they are today to the perfect end state. And I think if that's your sort of instinct and desire and want, it can lead you to like pretty counterproductive solutions.
Yeah. So final question for you. What are you most excited about today? What are you thinking about that you think is just cool, could be really exciting?
Yeah, great question. Because these days it seems like there are a million answers to that question, which is a little bit crazy. That's the time that we currently live in. I think I'm quite excited about what AI can do for developing countries, and in particular, I think I'm excited about like the potential for for such a transformative technology to basically create room for a bit of a paradigm shift. I think sometimes you need like a little bit of a shock to encourage governments to get out of a holding pattern and to get into like a sort of like permanently more productive trajectory. And I think things like thinking about how do we adapt like government and bureaucracy such that it can be like integrate AI is like a really good question. I think it's an exciting one for thinking about what will developing countries look like in 10 years. I think the answer is like potentially it will look radically different to how it does today.
That would be very exciting. I hope you write more essays on Substack. I'm a big fan of your Substack, so keep it going. Is there anywhere else that you can be found, like to be found?
Yeah, mostly I would say Substack. So that's newsletter.myname.com and Twitter, which is also just my handle, just at my name.
All right. I'll advocate for Substack, the least toxic social network. So, so
I
find
agree.
Dina there. Thank you so much for being part of the show.
Yeah, thanks so much for having me.
The Economics of Work is brought to you by Rebellion Labs, workforce data for research and benchmarking. If you enjoyed, please remember to rate, review, and subscribe. It'll help us reach other curious listeners. I'm your host, Ben Zweig. Our producer is Cole Wagner. Thanks for listening.